The start of the pandemic, West Virginia has seen a 49% increase in drug-related overdose deaths. Officials say 397 more people died of a drug overdose in 2020 than in 2019. At WVU Medicine Reynolds Memorial Hospital, an emergency room physician says they're seeing that happening. DK Wright takes a look at some of the forces at work behind those numbers.
People who are with a friend having an overdose often delay getting them help.
I think there's always a concern that either they didn't really take too much and they're just asleep, or they're worried about some legal implications, so they just kind of watch, their friend that's overdosed.
Bad batches of drugs hitting the street mean a rash of overdoses hitting the hospital.
We had one a few weeks ago where we had 4 overdoses within just a few hours time period.
Dr. Neil Olick says sometimes E-squads don't administer Narcan on the way.
The problem with giving Narcan is that sometimes the patients will become violent. If they do that in the back of an ambulance, that could be very dangerous for the crew. So a lot of times they'll just support the patient and breathe for the patient until they can get here to the emergency department where it's a little more controlled environment.
He says during the pandemic, it was harder to get in to see a psychiatrist or family doctor and harder to get pain medications renewed.
Certainly depression, suicidal ideation, things like that increased greatly during the pandemic, and even now there's still a huge backlog of trying to get people in and get them taken care of. So I think that's one big reason. The isolation has just been terrible for a lot of these people.
They're also seeing a huge rise in meth overdoses. DK Wright in Marshall County for 7 News, working for you.
And the doctor says his advice to families with a loved one who is drug dependent is get a Narcan kit. They're available over the counter now, and call 911 immediately in case of an overdose.
Rising humidity.